Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy, Walden University. And in this video or audio, whichever you're looking at, I'm going to be extensively going on mental health stigma. Now, out of all disciplines, out of all the subspecialties, mental health you cannot study without understanding stigma. If you compare mental illness to any other disease, mental illness is something that is heavily underreported. So let's go ahead and get started, taking a look at the abstract first. Not too much. It's like 3 sentences, and it just says that this behavior is consistent of underreporting of mental illness with the stigma of mental illness. So they showed that stigma can play a role in determining health-seeking behavior. Problem is that when you're looking for health secrecy, for instance, smoking and secrecy, due to social desirability bias, there's a tendency to simply hide certain behaviors or actions. With smoking, there's this stigma that if you seek if you do smoke, then that will be considered in a negative light. So the definition of stigma actually has been around 1960s, when Goffman actually made the same seminal work on this topic. So in the public health concern, they actually show the consequences of stigma and compare survey self-reports on diagnoses and mental health drug use to administrative data on prescription drug use in a sample of more than 250,000 individuals. So a large literature in psychology and psychiatry has examined the existence of stigma in mental health. The approach of using relative misreporting of mental health in a heterogeneous sample of about 250,000 individuals is novel. Nobody ever before had done that, using relative misreporting of mental health. So their work also complements a recent set of papers around HIV and others, just to show the stigma around self-reported health measures. Here are the results. As you can see, 36.5% of people observed using depression drugs. That's it. And the average underreporting rate of all other diagnoses is substantially lower, which is 17%. And so diabetes has the lowest underreporting, which is 11%. So 36.5% to 17% to 11%. What did they find? Basically conditional on taking prescription medication. They found that individuals are significantly more likely to underreport mental health ailments compared to other conditions. So they interpret the additional misreporting in mental health illness as evidence of stigma of mental health. And that is summing up what went on in this article. If you have any questions, of course, these are authors that you can contact. So thank you for listening.